This is your orientation to pharmacology. It is one of the first classes that I'll be opening up for you hopefully this afternoon. I just wanted to follow through. We're going to go through the Start Here module and go through each of these pages very quickly. And then I want to go through the assignments and how to do most of the assignments for the first unit. Then you'll be well prepared for me on orientation day. And we don't have to go through so many details then. So let's open up to Welcome to Pharmacology. Here you're going to have just a quick synopsis of what the course information is, what a little bit about what you're going to learn about each drug. Then we go into a little information about myself, which I'll introduce myself really well on Tuesday night. My contact information, you can read about that. Here are the days for virtual hours, on-campus office hours. I answer texts, I answer emails very quickly. I we are required to write out office hours, but because we are a hybrid course and we are a nighttime weekend course, I need to make myself available to whenever you guys need me to be available. Now, I'm not going to drive from Athens because I live in Athens all the way to campus on a day I'm not there if you want to meet in person, unless it is absolutely necessary that I have to meet with you. But if I'm there on campus, I usually get there Tuesdays and Thursdays for sure at 1 o'clock, sometimes earlier. Fridays, I'll be there with you guys for the first 8 weeks on Friday and Saturday. So if you need to talk to me then, you are more than welcome to, too. Okay. Mondays, I am with my granddaughter. I don't answer much email or until I get home that evening. So I might not answer a quick text or email during the day because my 2-year-old granddaughter just takes up my entire day. Makes it hard to follow along. The next page on the Start Here module is a course orientation for those students who probably not taken a Canvas shell style type class, if they've never taken a TJC class or other campus that uses Canvas. So this gives you how to set your notification preferences, what you prefer to see on your app, on the phone, how to change the dashboard around, and maybe you might want to take it from a shell picture type look to a linear look for you, and that sometimes helps. How to get your emails. I give out a lot of emails. You need to be monitoring for my emails, guys. And there's important information when I send an email out. So you might want to set those links up to where you get them right away. It also gives you guides to help you go through Canvas if you're needing it. It has student videos, and it will all help you understand how to use the Canvas shell. The next thing is our syllabus link. You are required to read the syllabus, guys. You can get to it through this link, or on the left-hand side is a navigation menu that has the concourse syllabus. You can go in there, and it's the same syllabus as here. Either way will get you there. And you want to make sure you read it. I'm not going there right now because I'm going to go through most of that's what's on there on this video. But you guys need to go through and make sure you read it. You'll have your modules in home, which takes you to the same place, your assignments page, your discussions page. I don't have any discussions. I really don't like them. I haven't found a good way to use those. Where you go to see your grades, your syllabus again, quizzes. This syllabus button is not the same thing. It kind of gives you a summary of what the syllabus says. Then if you want to see how many quizzes, and there is tutoring and library resources if you need them. The next page is the syllabus addendum, where again, my contact and office hours, but there is disability services for those of you students who feel you might have test anxiety, a learning disability like dyslexia, or you have a problem with concentration and comprehending language, maybe, and you need more time to be able to comprehend a question during test time, or you need a room where you can read the word out loud to comprehend it. then you have to go through our disability services with Margaret Rapp and make that information with them. Make that, um, sorry guys, make that appointment with them to get the paperwork started so I can do that with you. I am required to have the paperwork before I allow that to happen. And so if you already know you have that problem, you want to get started on that right away. If you find out through after the first exam that you may need something like that, or if I recommend for you to go and see this to help you, you might want to get that started right away instead of waiting till the end and you've now failed the course. You have your student handbook, which you need to be reading, or if you haven't read yet, you should be reading. And it gives you all the rules and regulations, policies about any little thing that you might have a question about. Please take the time to write that. When you get into clinical, you'll be signing a piece of paper saying that you did read the student handbook. Academic dishonesty is not going to be tolerated. Please realize that you're entering a profession that we are so trusted by the community and our patients that we're more trusted than a doctor is. And we take that to a higher standard within our profession. So we will not tolerate any type of dishonesty. For grading, this is how they are weighted in this course. And this is how my courses are all kind of weighted for all the other courses also. You will have 5 theory exams that are weighted at 60% of your grade. Your assignments, these are all the assignments that are 30%. And then we have a practice exam to help us with the actual standardized proctored exam that we'll be doing at the end of the course, which is 10% of your grade. With this practice exam, we are going to be doing some remediation that will be part of your study time to get better at pharmacology. As an overall grade for the program itself, you must have a 75.5% or higher to pass the course. Here's the key thing, guys. You have to get 75.5% in your average over these 5 exams. If you do not reach that 75.5 in your 5 exams average, you will have failed the course. We will not add the assignments in ATI to that grade until after you've reached 75.5. Then this gets added to those exams. That is what they're looking at for you to pass one of the nursing courses. Participation. I am expecting you guys to participate in my class. When I have you on campus, I have you for a very short time. I need to engage your brains. You guys are coming from an 8-hour day at work and coming into my class tired already, and I need to engage you in thinking, in processing information. If you are sitting there and going to sleep on me, we're both wasting our time. I am a different type of teacher. I do not stand and just lecture in front of you. Because I have such little time, I am activity motivated. We do games, we do things on the whiteboards, we'll do case studies. Sometimes I do round robins of different things that we're doing in the class. Anything to pull you out of that chair from sitting and falling asleep. I need you engaged. Participation means you are participating in those activities. You have not decided to sit and socialize. If I would come and see you guys socializing instead of doing what the activity is, I'm going to ask you to leave the class. I'm sorry. It's interruptive and disruptive to the other students who are participating when you guys are socializing and doing something different. If that is so, okay, that's up to you. But I will ask you to leave. I will give you one warning and come by nicely and say, hey, you're supposed to be doing this activity. Come join me. Da 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 da. If you don't follow suit, then I am going to ask you to leave the room and go socialize outside. Go sit outside till the class is over and socialize. Otherwise, then the rest of us can learn. That just isn't very unethical. Number one, it's very unethical, it's very rude, and it does not help your learning. Okay, so please be aware of that. Down below are the three people that are your student resources. Margaret Rapp, I mentioned before, for your disability services. You want to contact her if you have any one of those learning needs. A retention specialist, maybe you're a person that has trouble with retention. I need you to realize that everything we learn in foundations for these 4 classes is your foundation to help you get through second and third semester. You will be adding to that and building on that. You don't want to have to relearn all this stuff in second and third semester. That's just going to take more of your time. And you're going to fail exams because you didn't grasp information in first semester that you should have and that you need to use in second and third semester. So be aware of that and try to learn as much as you can and try to retain it. But if you think you need help, go see Darlene and see if she can help you with something. Tracy Williams, licensed professional counselor. She is the counselor for over 12,000 students on campus. But one of the things that's wonderful about her is that she'll make your appointment, and she sees more nursing students than she does any other type of student out there. And it's because of test anxiety and the student getting so overwhelmed that they can't concentrate to study. And so go to her to give you tips on how to stay organized, okay, and decrease that overwhelming feeling and that anxiety feeling. The next page gives you your course schedule for pharmacology. Of course, that first day is about orientation, but Thursday we're going to get right into doing all of our information and start doing activities to learn how to do most of this stuff. And look at your first exam. It is the week 3, unit 1 exam. You're going to have to be ready for it, okay? And then you're going to have exams between all 4 courses every week. And there's a couple of weeks where you have 2 exams in a week, all throughout there. So here's your schedule, tells you what's due by that Wednesday, and it'll help you out. Here just talks about where we're going to meet. You are going to get an email from me on your exams that says it's ready for download. I need you to download that before you come to campus and take care of any technical issues that you might have with that exam. You might have to call Exemplify because of something. If you wait and download that just before the test and you have a technical issue, all the other students cannot start the test until you are ready. You have just put a hold on our exam. We're there later. People are getting frustrated and upset. Download that before you get to us, please. There was one student who waited and couldn't even get it downloaded when she got there. And she didn't even, it was so bad. The technical issues were so bad that she couldn't even take the exam that night because it took her an hour to get through to everybody. And we just had to set another date for it. So make sure you're doing this before you come to class and take care of any technical issues you are having with your laptop. Make sure you bring your cord. During testing time, you might want to wear earplugs so that you're not hearing any outside noise and you can concentrate just on your exam. Material covered for each exam is right here on this page for each chapter, what readings that we're doing. As far as my makeup policy, there isn't one unless you have extenuating circumstances. You will not get extra time to study. These are on the date because we only have so many days to do so many tests, and I cannot push them later or start them earlier. So you need to do them at the time they are scheduled. If you have an extenuating circumstances, I expect a phone call or a text or an email from you before the exam begins. If you wait till the exam begins, then that doesn't count. Before the exam begins, then I am allowed to give you a different exam on a different day. So remember that communication is key to informing me of what's going on with you, okay? Here it just talks about the different assignments again, and I just want to go through those. It talks about how to see my comments. That's going to be very important, especially on your worksheets that you upload for me. I'm going to go through each of those worksheets and put little notes in there about your thinking. This is not go with this. This is your rationale on this is not correct. Let's look at that and make sure your thinking is. So make sure you're looking at any notes that I might be sending you. This is if you're having trouble with technical problems. This is your technical support page and what you need to do. Hopefully, you've worked all those out when you did your onboarding and got all that done. If you've never taken an online course, this is a hybrid course, and this is just a quick TJC online student orientation to that. It has some tips and stuff that you could probably look at to see, okay, I didn't know that about courses. A lot of our information you'll be doing at home to pass these courses. Yay! Guess what? You have ATI access. Here's your code. This is a handout with the code on it. Follow the handout and get access to your ATI products. It's very easy to follow. Just follow the prompts and you will have access to all of the ATI and you can get started right away on your ATI assignments. Here you have to take the Start Here quiz. This is proving attendance in the course. You will have to take a Start Here module quiz on every class that you ever take. So get ready to do this 4 times for me and twice with Miss Vega. I think sometimes she does a discussion question and that proves your attendance also. So you'll have to do that 2 things for Miss Vega to show attendance within the course itself that you need to upload for us. And that's what this is for. So this is 5 questions. There's no time limit. If you need to stop and go look at the answer, then come back, go for it. Yeah, I think you can take it twice to get 100%. This was something me and Miss Vega decided to put in here. You don't have access to edit it, but me and her do because we'll edit it as we go. She's working this week on getting her information in here for the skills lab and clinicals so you guys can have it all together. But this is the page that we gave you for onboarding. The exams, times, and everything on it have not changed. That is going to be when we meet and do. Some of the things that might have changed would be content. I've moved content around, and right now I've only got pharmacology done. So I put immunizations up here that might not be on your first one for you to learn. Okay, I got to go through and fix a little bit of the bottom of this one, but we're going to try and keep this updated for you guys till you can look in on it periodically and have that with you. What's really nice is to see all of your exams for the entire semester all on one page. So week 3 begins your exams with Pharmacology 1. Week 2, you're doing exam 1 for Med Surg. Week 3, you're doing Foundations ATI. That'll be the first Wednesday you come to class. And then exam 1 for Health and Illness on Thursday. Then we're back to Pharmacology, exam 2. Just like I said, 1 to 2 exams every week till the rest of the semester is over. So that's a nice little handy thing to have. Now we're going to go into the module, the unit module, and each unit module for the week begins. There's week 1 and there's week 2, begins with an introduction. The introduction has your outcomes on there, what you should know by the end. Here's the chapters to read. So chapters 1, 2, 5, and 36 are out of the actual Nursing Edition Book 8. You can access this through ATI. It's in there online. First day, you'll have a hard copy of it. When you get for orientation, you'll have hard copies of all the ATI books too. But these are bullet formatted. They are not reading. They're just bullet formatted to help you understand stuff. Your reading comes from the Introduction to Pharmacology and ATI. And here's how you get there. Go to atitesting.com, click on Lesson tab, Pharmacology Made Easy. This should be 5.0, not 4.0. Sorry, I got to change that. Click into Begin Lessons for Introduction to Pharmacology. Find do that and do your readings, and then you'll do the lesson. And I have a submit thing on here to help you too. Then it tells you to study your different terms, make sure you understand them, and it gives you your homework that's due by that date. Remember, the first week, I'm giving you that first week. Then after that, they'll be due on Wednesdays. Then the second page after your introduction is your lecture, along with your PowerPoints. There's your PowerPoints, there's your lecture. I like to put resources underneath the lecture if there's something I really liked that is optional. You don't have to look at them if you don't want to, but they are kind of nice. I try to choose anything less than 10 minutes in my videos, and giving you just a different way to hear the information. Sometimes somebody else might be able to trigger a word in you better than I can. Immunizations, this one's 20 minutes. This one up here for introduction is an hour. My lectures tend to be an hour or less. If there's only one lecture in pharmacology that's an hour and 16 minutes, and I'm sorry about that. I just had to do that to get all that information. I'm having to describe a lot of things because it's new to you guys, and so it takes me longer to get through my PowerPoints. Next is your readings. Here's your readings. ATI testing. Go to there. Go to my ATI tab. Find Pharmacology Made Easy 5.0. Begin your lesson on this. After you begin the lesson, you want to complete the module and begin the test. Then once you are completely done and you've spent a minimum of 1 hour in this module, you want to submit your grade for the test along with something that gives me the time. As you look down here, the individual performance profile can do that. Now, if you have paused and had to come back and then paused and had to come back, then you're going to have to add that part of the profile onto the screen when you upload your report so I can see that you were in there for 1 hour. You can spend more time, but you need to spend a minimum of 1 hour studying that information and reading that information. You have a lot of ATI to do. We want to set you up for third semester. This is the beginning of that, okay? You don't believe how much ATI you have to do in third semester. Here's another reading on the immune system. This one, I only want you in there for 30 minutes. They mixed it up with cancer, stuff about cancer. All I want you to focus on is the immunizations on this ATI reading. Go and fast forward through till you get to the immunizations. It's not very much information there, but it will answer any questions regarding immunizations that you need for the exam. You need to spend at least 30 minutes understanding it, then show me a profile. Don't do the test because there's a lot of cancer questions on it. Just do the readings and show me something that shows me you did it for 30 minutes, and I'll give you 100%. Okay? Next is your worksheets. Every week we have a worksheet that will help you with the information you're trying to learn. This one's for the introduction. Here's a mixed match with words and do. See if you can do this without having to look it up. That would be nice to tell you you're ready for the exam. Or do it once and then print it off a second time and see if you can do it without looking at the answers for you. True or false questions about the information to help with application. Then down here, the third thing is I need you to recognize what is a medication error. And in here, you're going to write yes if it is a medication error, no if it isn't a medication error and it was safe for what that nurse did. Then I did a crossword to help you with terminology again. So upload both of those. When you upload, I need you to upload one link, not 2 links, one link. Learn how to do that, how to upload one link to where I can just scroll through that to find that information. Next is your ATI dynamic quiz. Here, we're preparing you on learning how to answer nursing style questions. You're going to go to ATI, and we're going to do that so I can show you how to create a test. You're going to log in. I need to get to student view here so I can help you guys out. Your profile page comes up. Go to My ATI. Then go to the Assessments tab. You want to click on Dynamic Quizzing down here, and then Dynamic Quizzes, Quizzes and Assignments. And on this page, you're going to create a quiz. You're going to say New Custom Quiz. You want to put it in study mode. You're going to come down here and clear out all the blue checks. Click on Pharmacology Only, 25 questions, untimed, and then start the quiz. Oh, this is a fill in the blank. I want to go to the next one. I don't want to do a fill in the blank. A nurse is collecting data from a client who has been taking simvastatin to treat hyperlipidemia. Which of the following statements by the client indicates an adverse effect of the medication that should be reported to the provider immediately? Well, I don't know the answer to that, right? You don't know the answer to most of these questions when you first begin. This is part of your learning, okay? So I might have to guess. I've had occasional constipation. I've had some gas. My head has been hurting on some days. My legs feel weak and achy. Well, if I have to report something to the provider immediately, something went wrong, guys, on this question. So I want to see what went wrong that I have to call the doctor about for it. I'm not going to call the doctor about constipation or gas. My head has been hurting. That might be a problem, or my legs feel weak and achy. Out of these two, I've got to choose because I'm sure not going to call the doctor on those things. But I don't know anything about simvastatin. Now, I do as the teacher. I know the right answer. I'm going to choose a wrong answer just to show you that. Okay, so, that's the wrong answer. Now, you can click until you get to the right answer, which the right answer is this one. Okay. But what I want you to do after you click an answer is to go to the explanation. Why was it right? Why was it wrong? This is where your studying comes in, is studying these rationales for you. Number one, it helps you understand how the nurse is supposed to think. Number two, it helps you understand a little bit more of what that question is asking. Gives you, what did it want from me? What information did it want from me? And so, why did I choose the wrong one? What was my thought process behind that? Maybe I was just guessing, but maybe I did have a rationale in my head as to why I chose that answer. And let me find out why my thought process is wrong and straighten out my thought process. So I want you reading your rationales and studying them and finding out more information. After you do 25 questions like that, you can grade it, submit it, and here it will show you that you have done 25 questions, okay? That's all I care about, is that you've done 25 questions and that you've answered them, correct or incorrect. I don't want to see any unanswered of those 25. Now, you can keep going until you get 100% if you want. But I don't care about the grade. You'll get 100% if I see that you did 25 questions. Now, there's two ways to do this. You may be in a hurry and you just want to click through 25 questions and get it done and submit it. That's great. That isn't going to help you learn, though. If you truly want to learn and you truly want to do well in second and third semester, you're going to take the time to learn these medications and learn how to read these questions. You want to do great on my exam? I get all my questions from ATI. You might want to be looking at some of these rationales. So do your due diligence. Don't take 5 minutes, take 30. And do a little bit of reading and studying. All right. So now, after I do my 25 questions, next I'm going to do my quiz. This is a 20-question quiz that I have created. You want to have studied everything that you know about the introduction to pharmacology, all those terms, before you take this 20-question quiz. It is timed for 20 minutes. You want to do the best you can. You get one try at it. You don't get to see the answers until we discuss them in class on Thursday. We will go through each question, do a testing strategy, discuss why it's the right answer to help you guys get better and better at answering questions. Then I will reopen it for you to redo it again and give you a couple of days to go back and redo it. Now, if you take advantage of my kindness here, I will not continue doing this. And you will get the grade you get on that first exam. I need you to take that first time on this quiz and do the best you can. If you are doing the best you can and you're still getting a low score, then that tells me as a professor that I need to probably meet with you and help you understand what it is you're missing. Either you're not studying correctly, or your study habits might need to increase, or you're not reading the questions correctly. And I would need to assess you one on one to help you get better at it. But if you're just going to nilly willy answer these, I can't help you get better. That's the goal of doing it this way. Okay? So please take that first time you do that after you have studied and you're ready to do the best that you can on these questions. Then you got another introduction for week 2. We're learning 15 antibiotics, your homework that's due, your lecture with your PowerPoints. I'm going to open up these PowerPoints real quick. In these PowerPoints, you're going to notice something beginning with your antibiotics. Look at it's highlighted. Why would it be highlighted? Oh my goodness. Why did Miss Patterson do that? I just don't know, guys. There might be a reason why it is highlighted. And specifically for the antibiotics, when you print off the PowerPoint, print it off with my notes. You might be surprised what you see. Then, of course, any resources, it's up to you to watch the resources if you want to, or you don't have time. That's understandable too. The next page here is an ATI reading on infection. Here you are going to do the test and you are going to spend an hour. The rest of them, other than immunizations, you'll be spending 1 hour. Now we have our next assignment, which is a drug card. You will be doing 2 drug cards for your antibiotics, penicillin G and isocyanide. So here's an example. I created this card specifically for 2 reasons. Number 1, you need to know the drug. And the only way to do this is to make drug cards. Number 2, I need you to learn how to decipher information from a drug book. There's so much information under every drug. What's important to you as a nurse? And I want you to learn how to do that. The best way to do that is to create drug cards for me to correct and look at to see what you decided to pull out. And then I'll put notes on there. This will be graded according to that rubric. So you could lose a lot of points or gain a lot of points. You may not copy and paste my PowerPoint into these cards. I need you opening up a drug book. I will know the difference, guys. I know I created my PowerPoints. I know when I re-see them. Open up a drug book and decipher the information. That's the learning I want you to do with your drug cards here. Okay? And this is just your example. I'm going to quickly go through it so you know what you're looking for. You're looking for the generic name. You're looking for the pharmacological class of that medication. You're looking for the indications, the reasons why you would give this to a patient. Okay? The mechanism of action. It is very concise in here, so get concise for me. Don't write paragraphs in here. Mechanism of action. How does that work on the body? So here's that one. Then you're going to look at the side effects and the adverse effects of a medication. Side effects means this is something that can happen, but I can still take the pill and deal with these side effects like cramps. I can take some Advil, get rid of the cramps. The nausea, I can take an antiemetic, or maybe I need to take this with some food if it's okay to take it with food to decrease the nausea until my body gets used to it, and hopefully this goes away. Whereas adverse effects is a life-threatening event that happens due to being on the drug, and now we have to stop the drug. You cannot take it. Excessive bleeding. I'm hemorrhaging out. Lord, I don't need to be on a blood thinner. Dermal necrosis. Dermal means skin. Necrosis means death. Skin death. That's pretty bad. Okay, so those are adverse effects. Contraindications is these are the people that have these problems right here that should never, ever, ever be on warfarin or any anticoagulant here. So contraindicated in these types of patients. Interactions means something that interferes with how warfarin works. So it's going to interact with how it works, or it's going to make it worse or give it worse adverse effects. And so you list all of those things. See how vitamin K is in here? What that mean? Why? How does that interact with vitamin K? Well, how does it work? The mechanism of action. Vitamin K dependent clotting factors. We need vitamin K to make clotting factor 2, 7, 9, and 10. Well, I can't make those while I'm on warfarin because it's stopping vitamin K from making those clotting factors. But if I overeat on vitamin K, I'm going to overwhelm my warfarin level, and I'm still going to make those clotting factors and wind up with the DVT, PE, AFib, or a heart attack. So foods, herbs, drugs. What drugs will interact with this thing? Choose those ones that are fairly important, because sometimes that list can go on and on. I don't want to see an on and on list. I want to see what you decide in your brain is important to tell that patient. The second part of this is all knowledge about the drug. Simple knowledge, okay? Here, it's more about you as the nurse. What are you going to be doing as a nurse? Nursing implications. You're going to assess your patient first. You're going to find out what do you need to look at, touch, see before you give the pill to make it safe. Well, if my patient is already bleeding, I'm going to hold this drug, right? Does it have a therapeutic lab level that you need to look at? Well, warfarin does. It needs to be between 2 and 3. And if it's higher than 3, I'm not going to give that drug because now my patient's toxic. And I'm going to look for that toxicity by nosebleed, severe bruising, elevated INR, hematemesis, hematuria. I'm throwing up blood. I'm peeing blood. Oh my goodness. I don't want to do that. Okay. What labs do I want to look at? What signs and symptoms? Do I need a vital sign? Well, this one didn't need a vital sign unless my blood pressure is dropping and I'm bleeding. Okay. The next column is about patient education. What are you going to teach this patient that's very important? List all of those things that seem important to you and let me see what you come up with. Okay. For evaluations, how do I evaluate this medication to know that it's doing its job and it's therapeutic, it's working, my patient is doing great on this drug? Well, on this one specifically, therapeutic INR of 2 to 3, my lab's not out of range, no signs and symptoms of showing a DVT, PE, stroke, or an MI, no signs of excessive bleeding. Those are things that tell me my patient's doing okay on this drug. Okay? You're going to be doing a lot of assessing and evaluating. And that's what you're going to do for me on your drug cards. So, like I said, you have penicillin, and you have isocyanide, and you're going to be graded off that rubric. Here's another worksheet for you to do, and I did some questions. On the worksheets with the drugs, I added multiple questions, true, false, and then multiple choice questions. At the end of your multiple choice questions, you want to give me the rationale for choosing your answer. Choose your answer, then tell me why you chose it. What made you think that that was the right answer? And that's going to help me assess your thought process so that I can see if you're on the right track in thinking, or do I need to write a little note, say, hey, let's think about this instead of what you said? Okay. This helps me change the way you think about information I'm teaching you. Here's another dynamic 25 question quiz. Remember, you're going to do those once a week. All right. Then you're going to take my 20 question quiz that we'll review on Thursday, and you'll get a second try at doing this afterward. Now, the last thing I want to explain for this orientation is this. You have 5 exams. One exam is going to be 10 different quizzes. This is the first of 10. Each of these quizzes will have 10 questions. All 10 of those questions are going to be about one drug. This one is specific about fluoxetine. You're going to study it. All of the 10 drugs are neural drugs that you're going to need in mental health next semester. And so I wanted you to be really familiar with them and hopefully retain the information for mental health. All you have to do, shouldn't take you more than 30 to 45 minutes to do this, okay? And you will have after you do all 10 of these by the end of the semester, you will have an excellent fifth semester grade to help bump anything that you might have messed up between 1 and 4 exams in the theory exams, okay? You want to print out this medication information table here. It has all the information in bullet format, and you have it printed out. You want to listen to this 7.22 podcast of me talking about fluoxetine. Write down any information that's not on that table. Then you're going to study that little sheet. You can have that sheet in front of you. But if you do not study it ahead of time and you spend time during the quiz looking for information to try and answer a question, then you're not going to have enough time to finish the quiz. You have one try. There is no second try on these. This is an exam. You get one try and you get 15 minutes. So that means you still have to study that piece of paper and have an idea of where to find information in case you do get lost in the quiz. And then take the 10-question quiz. You have 15 minutes. So take 30 minutes to study, 15 minutes to take the quiz, 45 minutes. You're done with 1/10 of exam 5. Okay? So this is easy, guys. You can do this and get an excellent grade on this exam to help boost anything that might be too low. Then to end this unit, we have our exam, and I just wanted to show you that I have attached in here a terms of medications to know for the exam. So you might want to print this as you get started and then do it as a checkoff. Oh, I understand absorption. I've studied distribution. I understand what that is. I know what this is, and do a little check. Okay, I've done that. I know what oh, wait. Oh, I don't remember what this is. Let me go back and study that. Okay. What information do I need to know about that? So definitely a good help there. And then that ends our first unit. Every unit afterward is created the same way, and you'll get faster at all of these assignments. There's your quiz 2 for exam 5, your ATI reading in the hematologic system, your drug card for rivaroxaban, your worksheet for hematology, then your 25-question quiz for that week, and your I think there's only 16 questions on this one. Then these are all in week 4 here, guys. So you have 2 systems in week 4 that you are learning just because there's not very many drugs in either one of these 2 systems. So I put them together. And you're going to put that together. There's quiz 3. That is in 1 week, though. Okay. So this one's due on the 16th. I put your quizzes due on Monday nights. Okay. For the exam 5, those are due on Monday nights, not Wednesday. So you have a little bit more time with those. For you, and it just keeps going until you get to exam 2. And again, exam 2 does have that same thing as exam 1, a list of the medications you need to make sure you're working on for the exam. And if you have any questions now after doing this, let me know and we will go over all of this. Okay, anything you need to know. In orientation, put your questions down. We can answer them. I just didn't want to spend all this time going over the modules and the assignments on Tuesday.